we spend our time never forgetting the members that pass away, that are killed in the line of duty, or they're killed on September 11th. An important part about that, after we were exposed to the elements of September 11th and the collapse in the buildings in the rescue and recovery effort, so many of our members have gotten ill and had cancer, and as Andy was telling you, passed away from those trade center illnesses. We had to go down to Washington, D.C. to fight for the funding for the Zadroga bill. The funding for the Zadroga is going to run out in 2025. They're going to start reducing the benefits as we get closer to that date. That means we're not going to get the medical monitoring, we're not going to get the prescription drugs. So we have to go down to Washington, D.C. a third time to ask them to fully fund the Zadroga bill, to get our medical monitoring, prescription drugs. There's somebody that's affected by trade center illness in every congressional district in the country. So this is a nationwide issue. We're asking the senators and the Congress people to fund the Zadroga bill. We're asking everybody to call their senators and Congress people to fund that 9/11 Health Watch, contact them, fund the medical monitoring and the drugs. It's an important part for the firefighters and the people of New York City. And again, to commemorate this, general public's thinking about this once a year. We remember it every day because we never forget.
Right, the Zadroga bills put in place the plan for the healthcare for 75 years, going up until 2090. But they didn't include the funding. The funding has to be fought for every few years to refund the program. We have members now that are, in their last days fighting serious cancers. My own father has lung cancer. He was a survivor of the event, myself included. I have my minor illnesses, but those of us that were younger, we expect at some point in time will need much more care than we are receiving. Some members of ours are in the hospital now, and they may not be here next year. Many of them won't be here next year. But the ongoing fight for the funding is why we're here again. Once again, we're asking members of Congress to come through and fund the promise that was made when the Zadroga bill was passed. Saying the program is going to last until 2090 was a great promise to the 9/11 survivors and the people that were affected by what happened that day. But now it's time for you to come through with the funding and back up that promise with the cash that's needed to continue the health care for these people that are affected. Thank you.
I know and I've heard that family members, not responders like your dad, have also been affected by illness. Can you speak to that at all? Some of these asbestos or whatever brought home.
Well, there's a lot of people that you get exposure in different ways. We have members that were down here working, and you get it on your clothes and you go home. Maybe it's in your car, maybe it's in your on the clothing you wear and you wash. That could expose your family members as well. And even people coming down into the city during that time, anybody south of Canal Street was exposed to the air down here with all the toxins in it. So there's a lot of people that are exposed, and now 21 years later, we're still getting people sick. And as we've talked about before, a lot of firefighters and fire officers are dying from their exposure on September 11th and in the rescue and recovery effort afterwards.
Does Zadroga cover family members like that also with other people?
Covers anybody that was exposed that files their notice of participation, that they were here for 40 hours or, and so it covers
first responders, volunteers. It covers anyone that lived or worked south of Canal Street. As we all know, the plume of smoke that day, reached outer space. But the lawmakers drew a line at Canal Street, and they decided everyone below Canal Street that could document that they were down here was eligible. The group is in the tens of thousands, but up until when someone outside of the first responder community finds out that they're sick, they can apply and fill out a notice of participation. For first responders, that date is ending on Sunday, but we believe all of our members have already registered with the program, whether or not they're sick. But other people can register when they become sick, and as we know, every day someone else is feeling the effects of 9/11. That's why the plan is going to 2090. They understand the long-term effects of even short-term exposures to some of these chemicals.
Is there a predominant illness, like respiratory?
Respiratory illnesses are the predominant ones. Yeah.
There's also thyroid, brain cancer, skin cancer, and I think there's over 32 cancers that are listed right now that are Trade Center related. So and they were adding them every year as more people get exposed, and we have a number of firefighters that come down with these cancers. We applied to the fund to add that cancer to the drug on the cover.
We're currently seeing a spike in ALS. We're trying to make the case, and unfortunately we have several members that are affected by ALS, and we're hoping to get that cancer added so they are covered by this.
Autoimmune diseases as well.
A lot of these diseases, they take a long term to present after exposure, and now we're seeing ALS in several of our members. So, yeah, so that's metals consumption, I believe. Metal consumption. Yeah. So.
Thyroid cancer as well is we're getting quite a.
Curious, you mentioned over 300 who have passed away due to an illness. Do you have a closer ballpark exact number?
Well, we're just shy of 300 now officially, but there are dozens of members that I know of personally that were here. They were retired, and they came back to work, and they passed. They're not officially recognized, but the number is well over 300. But the official department number is, what I understand, 299 right now.
Okay, and obviously the
right. That's just firefighters.
Right, the 343 number has been burned into our psyche for so long, and now we're approaching that number of fatalities after that date. What does that signify to you?
Well, I understand there are other unions that have passed their number, their fatalities. I know the New York City Police Department lost 23 that day. The Port Authority Police Department lost 37 that day. I'm sure that the numbers of their members that have passed after 9/11 have exceeded that number greatly, due to the fact that we lost about 3% of the fire department in 1 hour, 343 members. It's taken 21 years to get where we are now, and unfortunately we do expect to pass 343, if not next year, the year after that. But it's not a milestone we're looking forward to, but we understand it's inevitable.
Do you think it's going to be harder this time to have the funding for Zydroga? That will elongate those.
The further we get from September 11th, the harder it's going to be, because people in government and around the country seem to forget. And we remember it every day because we have our members dying on a regular basis. And we get notified about people going into hospice or cancer treatment. So it's prevalent in the fire department, and we are always dealing with our membership. So that's why we have to remind the public and Congress that we need the funding for these things. And of course it's going to be difficult. It was difficult every time, and I don't know why it is, but having them realize that this is an attack on the country, not just on New York. And again, as I mentioned before, every congressional district has somebody that's affected by this, and it's in the Zydroga coverage. So the funding should be there. It's in everybody's interest, their constituents.
Well, we'll also be paying attention to the politicians that are going to come here and pay their respects and speak about the heroism and bravery of 9/11. And for the politicians that don't come here, who will undoubtedly update their Facebook and Twitter and Instagram feeds to commemorate the event, we will make sure that they come through when the bill is on the table and commemorate the event that way by continuing the health care for our members. So if they're going to be prepared to talk about it on Sunday, we expect them to be prepared to vote on it when it comes to the floor.
How much funding are you committing?
Approximately $3 to $4 billion. Is that the number?
I believe yes.
In the neighborhood of
The last time? Is that more than the last time, last round?
Well, it's just to fully fund it. It's an estimate, and to fully fund what's going to go out to the date that they've established. And what we've spent in the past, that dictates what we're going to spend in the future. But unfortunately, it also, because so many of our members are dying, that there's going to be fewer people to treat. And everybody that was down here feels that inevitably we're going to come down with something, just in your health, because you're feeling the effects. So that's why it's very important to have the funding for this, because we all know we're going to get sick and have some kind of ailment in the future. So we need the funding and the medical monitoring and the prescription drugs to help us survive those things.
Right. All of these clinics in the World Trade Center Health Program, they operate on budgets. And when they realize that the money is not in the budget, they must start making cuts. The last time we went through this, there were clinics that had to start letting go personnel, letting doctors go, because the money wasn't there to keep them employed. So the last time we went through this, it had gone to such a late hour. There were doctors that weren't hired, doctors that were let go and moved on, and we're really trying to get ahead of the disruption that's going to take place when these healthcare clinics have to budget out who's going to be hired and what kind of work they can accomplish with the money they're given. So this is a disruption that we're looking to avoid, but unfortunately every few years we've got to come back and have this conversation.
When was that last time?
2 years ago.
And I'm sorry, you said earlier that they're going to start tapering down money and ending it when?
As the money
in their budgets
runs out.
As the money in their budgets gets depleted and they can't budget for money that hasn't been allocated.
But I think you gave a timeline earlier as to...
Well, they're going to reduce the coverage because there's less money in the fund, and when it eventually runs out, it'll end. But in order to stretch out the money, get more out of it, they reduce the coverage and what they're going to offer.
And how long
Until
are
it
you
gets refunded.
anticipating? 2 years before it
2025 is what
when
they're
it
saying.
starts to taper off? Or when it's
Well,
out?
it's going to extend it past 2025 because they're going to give less services. So they're going to try and stretch that date, but right now it's estimated to run out in 2025.
For writers and producers back in house, spelling your names and job titles.
Andrew Ansbro, A-N-S-B-R-O, President of the Uniformed Firefighters.
Prices up, money tight. Are you feeling the squeeze? CBS 2 helping make sense of it all, sharing stories and ways to save. The Squeeze, only on CBS 2 and CBS News New York.
CBS News New York. Streaming hyperlocal news right down to your neighborhood.